healthcare data so much at risk when compared to the various other industries again? That's because the data here is about a patient or an individual's health. It's about an individual's health status or a disease status or whatever you want to call it, and it is so confidential, and which is one of the reasons why there's a lot of interest in getting access to this, and so that it can be misused, it can be put for ransomware and various other things, which is, and I believe that's the one big reason, because that's one big reason because healthcare data becomes a target. Now, what do you do to protect your data, and what do you do to ensure that the data is safe? The most important one, and again, this is again not just for healthcare but true for many other industries as well. We say the biggest vulnerability is always within, and when you say vulnerability is within, you mean your employees, you mean your staff, for me, every person who comes across a patient record within my hospitals and clinics. Mind you, none of these are malicious users. They're only ignorant, right? It's not because somebody wants to create any harm to any patient. It's because they're ignorant, and that ignorance is exploited by a smart hacker or a smart person outside. So, which is why the biggest focus and a lot of effort is being put by most of us to ensure that the awareness is continuous. You have to continuously speak and build that awareness with your employees and with your staff members to ensure that each one of them are very careful while dealing with patient data. So there is a lot of work to be required. There's a lot of work required to continuously build awareness, whether it is by giving training sessions, by having screensavers, by putting posters, but continue to remind the users that you should not talk to an external person about a patient data. You should not share the patient data or various messengers and systems that we have, and how to safeguard the data. Then comes the use of technology, right? You can put technology on top of it, but it is very clear that just putting technology and solutions or putting a lot of guardrails around it doesn't help you. It has to be a combination of people being continuously educated as to how they deal with data, and above it, putting the technologies like the data loss prevention solutions and various other security solutions that can be put to ensure that you safeguard the patient data.